Hi everybody, myself Dr. Sharath Kote GS. I am a consultant gastroenterologist and hepatologist based at Bangalore. Today let us talk something about the hepatitis. We all know that hepatitis means it's an inflammation of the liver. That means there is a swelling in the liver. So any wound, whenever it happens in the hand or leg, you would have observed that when the wound occurs, the next day the swelling comes. And similarly, whenever there is an injury to the liver, it produces a swelling in the liver that can produce various symptoms. Let us understand what are those most common causes which can produce a liver injury or a hepatitis. So in India, per se, the alcohol is the most predominant, but leaving to that is a hepatitis. We say hepatitis A, B, C, D, E. So there are many viruses which can produce a hepatitis. Along with that, we also have toxic hepatitis, means there are certain chemicals, there are certain medicines which can produce a toxic hepatitis, and rarely and also not least is a autoimmune hepatitis, where our own body defense mechanism will going to act on our liver and produces a inflammation in the liver. These are the most common type of hepatitis what we encounter in our day-to-day practice. And now let us understand how the hepatitis occurs, like predominantly in a viral hepatitis. We'll consider the viral hepatitis as a predominant, and the etiology being hepatitis viruses. This is a RNA as well as the DNA viruses, and it has some varieties like hepatitis A, B, C, D and E. And viral hepatitis A and E are most common, tend to occur in children, and viral hepatitis E is more common in a pregnancy and endangers the life. And A and E is most common mode of transmission is fecal, that is means when we are eating outside in the streets or unhygienic practices, the food and water contaminations, those are the most common modes of transmission of hepatitis A and E. And whereas when compared to hepatitis B and C, is the most common mode will be your parental, IV or the injections or unsafe sex, or the sharing the needles, razors, means these are whenever your mucous membrane or the skin exposed to the blood or the secretions which are contaminated with the hepatitis B and C is the most common. Hepatitis D also always follows with the hepatitis B, because hepatitis D cannot survive in the absence of hepatitis B. Now let us understand how the alcohol will have an impact in the liver. See, we know that alcohol become a social toxin. We can call it a social toxin because people say because of the social status and all, they initially started with the small quantity of alcohol, later they keep increasing their quantity and end up in the liver disease. This has various aspects when compared to alcohol, because people will say my neighbor is there, he is drinking so many years, nothing has happened. Then there must be some factor which are affecting, like person, he is having obesity, they are more prone, and a female sex predominantly because they have a deficiency in the enzymes that may lead to increased toxicity. So, and also some Hispanics, they also have an increased predisposition. Along with that, the most important is a malnutrition, because if you look into alcohol people, and in the bar when you observe them, they will be drinking, but at the end they will not have any food with them. So they will be having some spicy items or some oil fried items. They will not give enough nutrition to them, so they will end up in having only the nutritious less an alcohol, which has only an ATPs, no nutrition at all, and also some of the spicy items which also doesn't contain any essential vitamins or minerals. So malnutrition is one of the predisposing for alcohol. Next comes is the drugs and the over-counter table medicines which can produce, and also complementary and alternative medicines which they have taken from people who are not studied in detail about the drugs. We have seen many of the people losing their life just because they have taken some of the alternative medications by people who are not studied about that. So these are the most common modes where your hepatitis spreads and also enters your liver and lead to the hepatitis. The other one of the etiology which in a recent condition which have been increased in trend is a non-alcoholic steatohepatitis, means a person who doesn't drink, non-alcoholic. Steato means the fatty liver, hepatitis means there is an inflammation. So the inflammation has induced because of the steatosis, which is not related to alcohol. So this is a disease of lifestyle modification, because of the presently the people are shifting towards the modern lifestyle, shifting towards the modern foods which are processed and highly plain carbohydrate predominant diets. So those are causing this lifestyle disease that is called as NASH, which can endanger the liver over long time, which we need to be aware and also have a prevention strategies with a lifestyle modification. Till now, we have learned about the hepatitis, how it causes, what happens, all those things. But how you diagnose it? So, what makes you to think whether you have an hepatitis or not? So, most common symptoms will be patient will be having fatigue, decreased appetite, malaise, even no interest in the surroundings, loss of appetite. He is unable to take the food. He have a food aversion. These are the different kinds of history which a patient gives. They also, if the patient is having a hepatitis, they will have a fever with chills and rigors. If they'll have a prostrations, body pain, myalgias, all those things will be there. However, the other predominant symptoms will be nausea, vomiting can be there depending upon the cause. Till now, you have learnt all about the hepatitis, what are those causes, how it affects you, all those things. But now let us understand how you will identify yourself or what are the symptoms which a person comes with a hepatitis. So most common complaint with hepatitis is there are two segments. One, people coming with the presence of a jaundice, that is a yellowish discoloration in the eyes and passing dark colored urine, clay color stools. The other segments will come with a fever with chills and rigors, body pain, myalgia, prostrations, loss of appetite, nausea, vomiting. These are the most common symptoms which a person come with. So when they come to a gastroenterologist or a physician, you will going to understand some of the physical signs which can show direction towards it. Like suppose if the person is having an icterus, means that is a yellowish discoloration in the eyes. What is it? Whether it's a yellowish tint or a lemon tint, or whether the patient is having associated pedal edema, means the swelling in the limbs, or whether the patient is having associated abdominal distension. That can give a clue whether the patient liver history or the liver disease which is going towards the chronicity. And also we'll going to evaluate the patient with a series of blood tests like a liver function test, where the presence of an elevation of AST and ALT. These are the enzymes which present in the liver cells. When there is an inflammation in the liver, the cells get disrupted and the enzymes get released. That leads to elevation of the AST and ALT enzymes, also associated with rise in bilirubin depending upon the etiology. So if it is a hepatitis A and E, there will be gradual rise in the bilirubin, whereas and also there is a rise in AST ALT in terms of thousands together. Whereas if it is a chronic hepatitis, if it is an alcoholic hepatitis, the rise in enzymes might be around 200 to 500 and the bilirubin can vary. And you will be the getting evaluated with the series of blood tests depending upon the cause, hepatitis B, C, all those things. Antibody assay will be there. If you are suspecting an autoimmune hepatitis, you will have a autoimmune hepatitis panel will be there. And the imaging, most common modality of imaging will be an ultrasound to look into whether it is inflamed, whether it is shrunken, the size has increased or not. Suppose if there is a jaundice, then you will going to evaluate is there any dilatation of the biliary radicals inside the liver. So the USG will be the ultrasound will be the initial modality of choice for the imaging. Later it can go to the CT scan and MRI scan. Till now you have learnt about the hepatitis causes, how they present, all those things, but how you treat it? It's as simple as it is. Nutrition is the predominant and the best mode of treatment to the hepatitis, because people when they have jaundice, they say a lot of food restriction, yellow, so this fruit is yellow so you can't take it, this food is yellow you can't take it. So that is the most common mode, and they will be keep hydrating with only the buttermilk, all those things. So give a proper food, proper nutrition, that is the main source of treatment for the hepatitis A. Let's go with the causes accordingly. If it is a hepatitis A and E, symptomatic treatment, IV fluids with or without any requirement of other liver supportive, he will recover. When compared to hepatitis B and C, hepatitis B again it's a self-limiting and only require treatment whenever the jaundice is having very higher level or INR is more than 1.5 and it has a protracted course. Then only requires antivirals. Whereas hepatitis C, it's a chronic and it has a antivirals which are having shown a best efficacy of clearing of virus up to 99%. So hepatitis C has an antivirals. When compared to alcohol, abstinence is a main mode of treatment in alcohol along with the nutritional supplementation, and also they will be associated with other micronutrient deficiency like thiamine, B12 deficiency that need to be addressed in a alcohol induced hepatitis. These are the ways most commonly it will be treated. Then can it be prevented? Yes, definitely you can do a preventionary strategies. Prevention has some of the things: maintaining a nutrition, first thing. Second thing, vaccination. If it is a hepatitis B, hepatitis in a children's hepatitis A and B together you can vaccinate. Whereas in adults, vaccinating with the hepatitis B will be a good enough. And also in case of alcohol, keeping the abstinence is a main mode of prevention of treatment of hepatitis. And other modes of prevention will be hepatitis B and C will be not to share the needles, razors, needle pricks, avoiding the needle pricks, having a safe sex. These are the most common modes of prevention of hepatitis. The another one which is most important, which you will be aware in a present scenario, is prevention of a NASH. So most common disease of lifestyle modification. So you need to do a lifestyle modification in the form of at least do a walking of 4 kilometers per day or a 10,000 steps, not for the whole day. It is get up early in the morning, 5 o'clock to 6 o'clock, walk for a 4 kilometers. That will maintain your health. Weight reduction, having a proper food, vegetables, fresh vegetables, fruits is the most common. Increase the fiber intake, and also reduce the fast food, reduce the red meat, which are again the most common cause of your NASH, and also the processed food, the bakery items, and the simple carbohydrate based sweets, which are always in the bakeries. So always a complex sweets, yes, definitely it is allowed because it has a complexity of carbohydrates, proteins and fats, so it is allowed. Whereas in case of simple sweets, which are easily converted into triglycerides and get deposited, so NASH is one of the most common preventable disease. Healthy liver is a main goal of a present scenario, because so many patients, young generations are coming with a lot of problems with the liver, NASH, NAFLD, hepatitis B, hepatitis C, so many causes which the present generation is suffering, because they are the working population of our country. So when they get affected liver, it has a long protracted course, loss of economy, loss of quality of life. So healthy gut along with the healthy liver is a main goal. To have a healthy liver and a healthy gut, the best mode of prevention will be having a healthy diet, including vegetables, fibers, omega-3, omega-6 fatty acid rich food items, and also getting a vaccination, having a safe consumables with the when compared to the over-counter table intake of the medicines, because do not take any medicines unless there is advice from a physician. Healthy gut and a healthy liver is a present primary goal of a present generation. To have a healthy gut and a healthy liver, you need to have a balanced diet. You should avoid all these artificial sweeteners, artificial flavors, artificial colors, and with rich intake of the fruits and vegetables along with the complex carbohydrates, which will going to help you to keep your gut and liver safe and healthy. Avoid alcohol as much as possible. People might say this much of amount of alcohol is safe, this much is safe, so nothing will work. Poison is always poisonous. Quitting an alcohol is always a solution. And regular exercise and a walking of 4 kilometers per day keeps your health always fit and also the healthy liver. Thank you.